Greetings to everyone. I hope that this is the last video I have to do because I think that next week I'm going to be able to send out an invitation and you will be able to participate by Zoom. So we'll see. I got my fingers crossed. We'll see. It'll be a lot more interactive. But I do get feedback and I do get some questions raised and so forth. So I'm going to make every effort to address those in what I want to talk to you about today. You know, most of the time I come with these conversations, the videos, and I'm very optimistic and very, shall we say, up. But I'm going to admit to you today, I'm pretty down. I'm pretty discouraged. And the reason for that is because over the past week, I've been getting a lot of reports, both from us, from other employees and staff and what have you, from patients and from the community in general. We have some real problems around safety. And by that, I mean the guidelines, the most important guidelines for safety that we have implemented have been two. And that is that masks would be worn by everyone when doing any Care South Carolina work. Now, I think that was interpreted as only being in the office. And now I have to pick up my other office assistant. I should just learn that when I start these videos that Samson's going to want to be in my lap. I may have to learn that in the future. So as I was saying, if some folks interpreted this that these requirements for social distancing and mask wearing were only applicable if they were in an office, that's incorrect. Although we've been hearing about these problems not only when staff are out and about, but also when they're in the office. And I'll tell you, that's real discouraging. It's discouraging for me in several different ways. We are trying very hard to come up with a way to provide some incentives or some add-ons, some things that some people would call hazard pay. We can't really call it that, but let's just call it a pandemic risk pay. That sounds pretty good. A pandemic risk pay. We are asking for other community health centers across the country to share with us if they have any models. Folks have been asking HRSA if that was allowed. And now we have, a fairly good idea that, number one, it could be allowed. It would have to have board approval and a few other criteria. So we've been trying very hard to get something pulled together. And then I hear about staff that must not be too concerned about risk because they're not wearing masks, they're not observing the social distancing requirements. So that really puts me in a bad position. It's very discouraging. I have asked all of the senior leaders to reinforce our safety guidelines around social distancing, the 6-foot requirement, and around mask worn whenever you are doing any South Carolina business, whether you're in an office or whether you're outside or whether you're delivering meals or working on something. The community sees you. They see you. And we want to be leaders in the community. We want to set a high bar for letting folks know that this is a serious pandemic and we are taking it seriously and we don't want harm to come to our employees, to ourselves, most importantly to the patients and other community folks. So I'm going to watch and see what happens over the next several days. You know, many of you are on site, many of you are in offices. Help each other, help each other. This is a new thing. Wearing a mask and staying 6 foot away, that's a new thing. So help each other. You know, talk to each other, say, we need to get our mask on. I forgot all about it after I had lunch or something like that. So we have got to work on this. I'm not giving up at all on there being some kind of support for those that have had a heightened risk. I'm not giving up on that, but I am very clear. I'm discouraged. So I've got to ask your help on that. Moving on, I'm going to give you some news. So I think I talked to you last time about drive-up testing, that we were going to be implementing some drive-up testing, and we have. This last week, we did some drive-up testing events in Society Hill, in Hartsville, and in Bishopville. And they turned out really, really well. We got a few things we know we need to improve on and kind of fix. We need to be a little bit more prepared for the weather. But in those 3 locations, we did 105 drive-up tests. So that is wonderful. That's wonderful for a lot of different reasons. South Carolina right now ranks 46th in the nation around the number of tests that we've been able to do. Not only that, in the cases and the tests that have been able to be done, there is a pretty big disparity. Over half of the cases that have proven to be positive are non-white, and only 42% are white. Well, that means we really have to work harder to really encourage folks and create a safe environment where they understand that we're not going to put them at risk while being tested. So we're working really hard on that. It's been very successful. I really have the goal, and we've been talking about this, the vision of being able to have at least one site in every county that can do drive-up testing. Not all of our locations are suited for it. Some are small and really don't have the capacity to do any drive-up testing. But our goal is if we can get at least one in each of the counties. So we're going to continue to work on this. We're really encouraged. The community accepted it so well, and we're really excited about that. So Samson, once you get up here and then you want to get down again, you got to stay now. I also want to let you know about telehealth. You know, we have been doing, I've told you about telehealth before. We've been doing so good in telehealth that Jerry Andrews actually got asked to be a presenter by the Palmetto Care Connections group as they did a webinar earlier this week. She did a wonderful job, and it's very exciting to be a leader in this area of the provision of services, medical, behavioral health, and we're even going to be testing out doing some dental screening by telehealth. We've done, I think, about over 3,500 telehealth encounters, and the federal government is relaxing telehealth requirements. So we're going to really be able to do a lot more, and most importantly, in some cases, get paid for it. So this is a really, really good thing that's beginning to happen. We're really hoping that a lot of these things that have been rolled out can be continued over the pandemic episode. I want to reemphasize employee testing, though. There were some questions that came up about my comments last time, so I'm going to repeat. Testing is open to all employees. You can have it done either in the office, in the building, or you can have it done at one of the drive-up locations. There is no cost to the employee, and you don't have to have symptoms. Now, we're going to screen you we're going to ask you a few questions, but that's just because we need to make sure that if by chance you did have some symptoms, that you understood the need to be able to need to go home and self-quarantine. If you get tested though, and you don't have any symptoms, no, you don't have to be quarantined. So don't worry that just the act of getting tested will land you in quarantine at home. It won't, unless you have symptoms. And in that case, you'll have an opportunity to talk further with nurse and some of the provider teams. So let me reassure you on that. Just the act of testing isn't going to result in you being sent home from quarantine if you don't have symptoms. We are still facing a really difficult situation. Things are not all that good in our service area. Y'all might have noticed that John Douglas has kind of been our data guru, and he's been working on the task force for the last several weeks and compiling all of the data that comes in from so many different resources. He did such a good job of that, and he compiled it into a digest that we actually asked him to start sharing this with staff. And he is putting out a weekly digest. The last one came out Friday last week, and I fully expect one to come out this Friday. Spend some time in that. I know that it's sometimes complicated to look at data, and data is not everyone's cup of tea. But there's some important things in there, things that we need as healthcare folks, healthcare providers, healthcare staff. Our communities aren't doing so well. There's one page in there that describes a scorecard, and it's a scorecard for social distancing. And you might be wondering and scratching your head on how can there be a social distancing scorecard? Well, they take the data that comes from our cell phones. It's got GPS tracking data on it, and from that data they can do this big analysis, and they can figure out, well, is everybody staying 6 feet apart? Here are the grades. South Carolina is the only state in the nation that has an F. Not good. Chesterfield County has a D. Marlboro County has a C. Yay, Marlboro. Lee County has a C minus. Darlington County has an F. Dillon County has a D. The United States as a whole has a D minus. If I was a parent to those counties and got that scorecard, many of y'all are parents. I don't know how you would be able to perhaps not send your student to the room for the next month with that kind of scorecard. So we've got work to do. And in that work, we need to be setting the example. That's why it's so disturbing to hear that our own staff are not wearing masks or are congregating in clusters, not observing 6-foot distancing guidelines. Be leaders. People look to you. You are important. What you say is repeated and often gets talked about throughout the community, your friends and your family. Understand that we're in the worst healthcare crisis since the Spanish flu pandemic. This is very serious. Be leaders, be safe, and stay well. We're going to do everything we can to support you. Goodbye for now.